This now still now your health on top. Good morning, NAIJA show. Welcome to another powerful segment we concern this eczema matter where we don't talk, they come since. I promised you yesterday say I will show you the different types and some of their treatment, because for you to understand as this eczema they be, it's good to understand the types where they and how you go take follow their matter. My name now still Dr. Adaora. Yes, the first one I want to give you now. Atopic dermatitis. This is now one type of asthma. Now the most common form of eczema, and it often affects people who get asthma or hay fever. Hay fever and that fever where they make person body hot, and it could be like say they dream. Then people will get a family history, as in they get this eczema for their family, asthma or hay fever. Then if you get defects for your skin, as in inside your skin, get some kind mistake where they make what the water is supposed to be on top of your skin, they come out and germs and infections, they enter inside. This atopic dermatitis, they usually begin during when person be small baby or when it be small pikin. But if it attack anybody for any age, most of the time it affect the skin where they on top of the face, the hands, the feet, or your inner elbow and the back of your knee. And as you they do if the thing they taste small, if you too they scratch your skin, this one will make them they thick, become red. Scratching too will create wounds where infection fits enter. Then you get some kind of irritants where we make these symptoms of atopic dermatitis today worse, like soap, your clothes wear rough, some kind of household chemicals, some kind of food, you get something where they call dust mites, and any other thing where if you trigger allergy, if you make these symptoms, they worse. The treatment for this atopic dermatitis include products where go lubricate or moisturize your skin. Yes, you get the one where they call steroid cream and ointment, where they sell over the counter. Then some kind drugs where fit control your immune system well, because you know, say we don't talk, say one of the causes of this thing, that say your immune system, they overactive. That's not the soldiers where they fight the infection. Then sometimes antibiotics too. Sometimes you need to take these antibiotics to treat the infection. You get what they call UV lights alone or with a drug where they call a soraline. But anyway, now your doctor will send you the remaining of these ones. The next one now, contact dermatitis. Contact dermatitis. There be two types of this contact dermatitis. One now irritant contact dermatitis, and the second one now allergic contact dermatitis. This type of eczema that we develop after one kind substance don't damage your skin. For example, some kind chemicals and the frequent hand washing. When they wash our hands with some kind things. Now this irritant contact dermatitis, if it develop when you don't touch one strong irritant, one chemical where don't, can scatter everything for your body, or when you don't they in contact with this irritant every time. For example, if you walk for a place where they use some kind of chemicals when it is good for your skin, and you too they touch them, maybe if they relax hair, they wear gloves or something like that, things like that will cause this irritant one. Then this contact dermatitis, if it develop after you don't touch some kind of allergy triggers, like nickel. This one are some things waiting that they put inside coin. There's some kind of cosmetics. Then your hands, they're very open to this developing this contact dermatitis, because plenty people that they develop this contact dermatitis even if they not get atopic dermatitis. Treatment for some of these irritants and contact dermatitis now make you they use moisturizer, steroid medication like I don't talk before. Then some kind of treatments from allergic triggers still include these steroid drugs where you fit rub on top your skin or you fit swallow them like pill. And for any type, whether not the irritant one or not the other one, this one if you take antibiotics depending on what your doctor prescribe to they give you. But I beg make you they avoid any contact with anything where say they irritate your body or they make you they break out with this eczema. If you they wear gloves where they protect your hands, this one too fits, they help you. The next one now, Dyshidrotic dermatitis. And this type of eczema, they affect the hand and the feet. Doctor never know waiting they cause this one. Now here I go bar break on top the matter. Tomorrow I go send you the remaining types and the things where you fit do to make sure say this thing no build 5-bedroom flat for on top your house. My name is still Dr. Adaora Odola.